Well, welcome back to Cape Town, Balisa. Indeed, it is day 2 of the 17th World Conference on Tobacco or Health that's currently taking place here at the Cape Town Convention Centre. Now, I think they said that there are more than 2,000 delegates that are part of this conference from more than 100 countries around the world, all here to deliberate and discuss to see how we are doing in terms of tobacco control globally. Now, something that was interesting that came out of yesterday's press briefing with the Health Minister, Dr. Aaron Motsoaledi, was that South Africa was actually one of the first countries to legislate against tobacco. But indeed, the minister did concede that we have lagged behind in recent years. But of course, we can still catch up. Now, to talk to us more about how South Africa is doing in terms of tobacco control is Peter Ucko. He is the CEO of Tobacco, Alcohol and Gambling Advisory Advocacy and Action Group. A mouthful. Good morning to you, Peter.
It is. Good morning, Nomawethu.
Peter, now you are one of the first few people that started talking about smoke-free towns. Talk to us about Edenvale.
Yes, a long time ago, before it was even fashionable. And believe it or not, Edenvale, little Edenvale with 50,000 residents, was the first town to ban smoking in public buildings in 1989. That was 12 years before our law came into force. It was a very exciting time because we set the scene and standardized public acceptance of not smoking in public buildings at a time when smoking prevalence was as high as 40%.
Now, you are also mayor at that time. We've seen something similar with Michael Bloomberg in New York.
Yes, as it happened, I was the mayor of Edenvale, and it just simply did not make sense to me that we wanted young mothers to come with their infant children to our clinics to be weighed and immunized and so on. And there were nurses and other mothers who were smoking. It just did not make sense. So we banned smoking in all municipal buildings in 1989. Now, fast forward to Michael Bloomberg, who was the mayor of New York, who banned smoking in New York, I think in 2003, to a huge outcry. Pubs said they were going to go insolvent, and it was an enormous risk to a degree that Michael Bloomberg took, but he knew that it was good for public health, as we knew in Edenvale in 1989. What happened? Successfully went no smoking in New York, and in the 2 years following the ban, 843 new licenses were issued and 10,000 jobs created. So banning smoking is great for business.
Now, also, Peter, you know, with the minister yesterday saying that South Africa was actually the first country, one of the first few countries to legislate against tobacco, but we have lagged behind. He spoke about the amendment of the tobacco legislation. What do you think about this? What has gone wrong and what can be done?
Well, I wrote in an article recently that South Africa has moved from leaders to losers. But we can get back to being leaders, and we have to do all the things that are in the process of happening. We have to remove the 25% indoor smoking. Having indoor smoking areas doesn't work. It's not good for public health, and it's not good for business. Having displays of tobacco products is not good for public health because it's an advertising platform for the products, and the youth tend then to take up smoking. When you hide displays and you do not see cigarettes, then the youth are more likely not to take up smoking. There's many things that we can do.
I actually want to interject there, Peter. Talking about the youth and smoking being fashionable, talk to us about e-cigarettes.
Electronic cigarettes are bad. They're not good for you. Some people say, yes, but electronic cigarettes are safer. Okay, so they're a bit safer. But they are not safe. They are not harmless. They're harmful. There are risks of dual use. So here, wonderful flavors in electronic cigarettes, and the youth are tempted to start using them. But they then get addicted to nicotine, need a more powerful feeling of a drug because it's not enough from the electronic device, and then they go to smoking combustible cigarettes. That's the danger, and eventually they die prematurely.
Thank you very much for your time. Well, that was Peter Ucko. He is the CEO of Tobacco, Alcohol and Gambling Advisory Advocacy and Action Group, talking to us here at the Tobacco Conference in Cape Town. Now, he's saying a lot of things. You know, yes, South Africa is lagging behind at this point, but we can still get back on track. Now, we'll have more interviews for you here at the conference, but for now, let's link to an ad break. Stay tuned.